I visited an orthopedic specialist. We did some x-rays, some MRIs, and an EMG. He couldn't get to the bottom of it. He suggested PT. So I went to PT for a good 2 months, and it just didn't improve things. Thereafter, and I mean a good 6 months later, because the pandemic started, I visited another neurologist. And I had to take my shirt off for him to look at my back. And he immediately said, there's a concavity in your shoulder. And that's how I got pointed to Dr. Elkwood. He actually said, quote, he can fix this. My name is Mark Russo, and I'm a patient of Dr. Andrew Elkwood's. How did this injury happen? I honestly have no idea. What I know is that I woke up in the middle of the night with like screaming pain in my left shoulder. And the next morning, my arm was numb. It felt not really part of my body. I was trying to wash my hair in the shower, and it's still, I could raise it, but I wasn't sure it was on my head until it hit my head. I couldn't put my seatbelt on. I couldn't put my jacket on. I'll never forget, I was sitting at the kitchen table where I'm sitting now, and I tried to lift a bottle of ketchup, and I couldn't do that. So after going through the first round of physical therapy, frankly, I let it slide for a couple of months. And then just before the pandemic, I sought out another consult because it wasn't getting better. I saw a neurologist. He pointed out immediately a concavity in my back and said, you need to see Dr. Elkwood in Shrewsbury. He can fix this. And that was the first time I actually had some tangible hope. When I first met Dr. Elkwood, he was methodical, he was clear, and he was fun. I mean, he was kind, he was compassionate, and basically spoke through a lot of the anatomy and physiology associated with the brachial plexus on my left side. And from there, we did a bunch of testing. I loved his use of metaphors. He was constantly talking about, we can do this, we can do that. We can basically run an extension cord from an active nerve to an inactive nerve. And then it was always, do you have any questions? Do you understand? It was crystal clear. I had nothing but great experiences with the entire team. Everybody I spoke with and emailed with at the practice was so pleasant and so responsive. I'm not numb. I'm not numb at all anymore, which is fantastic. And the strength is starting to come back. So recovery-wise, so I'm still definitely in the recovery. I sent my stitches out last week. I started tracking the forces that I can impose with this left shoulder. And I've got a little log, and I'm working with the PT folks. So it's going well. These types of injuries could take months to a year to basically work themselves out. So we're on that journey now. I would absolutely recommend anybody and everybody who has any kind of a problem like this to consult with Dr. Elkwood and the staff here.